Okay, welcome back everyone to the deep dive. Today we're tackling a topic that you actually brought to us, medical tourism.
That's right. And we've dug into some really, well, quite insightful source material here. A discussion with the president of the Medical Tourism Association and also a Harvard professor, the
Yeah.
one who wrote Patients with Passports.
Yeah, foundational text. So our mission today is pretty straightforward. Unpack the key takeaways, the warnings, and the practical advice from these experts.
Exactly. To help you sort of navigate this, if you're considering heading abroad for medical care, could be for cost reasons, maybe availability or, specific kind of treatment.
So let's jump right in with the big question they tackled first. If you are looking into this, where are the good places to go? And maybe more importantly, what specifically should you be looking for?
Okay, so what was interesting is that the experts we looked at, they didn't just rattle off a list of countries,
Yeah.
What they really stressed was looking for places with significant government oversight, real reporting requirements for their medical travel programs.
Okay. So it's less about just finding a shiny hospital and more about the kind of the system surrounding it.
Precisely. They mentioned Singapore, Thailand, South Korea as examples.
Right. What made those stand out in the discussion?
Well, the key thing, according to the sources, is that the governments there aren't just letting it happen. They're actively involved,
Yeah.
regulating it.
Right.
And that oversight, that can be huge for you, the patient. It often means better access to reliable data on outcomes and maybe some protection from totally unregulated players. Gives a transparency you might not find elsewhere.
That makes sense. Transparency is key. So, all right, let's say you've done that research, found a country, maybe even a specific clinic or doctor online that looks promising. How do you make sure that's the doctor you actually get? The sources flagged this as a potential bait and switch, right?
Yeah, they really did. And the practical advice here was crystal clear. You need to ask no. Insist that the specific physician you researched, their name, is written directly into your contract.
Wow. Okay. Get it in writing. That specific name.
Exactly. That creates accountability.
Seems absolutely vital. And speaking of vital things, they were also really strong on not going alone, weren't they? The need for a companion.
Oh, absolutely. They basically said trying to do medical travel by yourself is, well, incredibly tough and just not a good idea. You really need someone with you.
A support person.
Yeah, ideally someone who can help navigate things, maybe language issues, the logistics, especially when you're feeling vulnerable after a procedure.
Definitely. Now, this next point from the sources, this is one that might not immediately spring to mind. It's about the local laws and sort of the social norms of where you're going.
Right. This is crucial. You've got to look into whether your companion, spouse, partner, friend, whoever will be, accepted socially, but also legally recognized.
Legally recognized. How so?
Well, think about important documents. Like, would a power of attorney from your home country even be valid there? Or a living will? These aren't small details if, God forbid, something goes wrong. You need to know if those legal safeguards you think you have will actually work in that specific country.
So checking the local laws on recognition, enforceability of your documents for your specific situation and companion, that's a whole other layer of homework.
It really is. It goes way beyond just the medical side.
Okay, so let's quickly recap the key takeaways from the sources for you, the listener.
Yeah, so number one, look for destinations with that strong government oversight and transparency. Think Singapore, Thailand, South Korea as the examples given.
2, get your specific chosen doctor named in the contract, no ambiguity.
3, don't go it alone, have a support person.
And 4, investigate those local laws and social norms. Make sure your companion is accepted and your legal documents like power of attorney are actually valid there. And while doing all that homework is important for you, the patient, there was another really critical point raised in the source discussion.
Which was?
That this huge burden of due diligence, it really shouldn't all fall on the patient.
That's a powerful counterpoint. The system itself has responsibilities.
Exactly. Which leads into the final thought the Harvard professor left us with. It really stuck with me.
Go on.
Well, the point made was about the phrase caveat emptor, buyer beware.
Right, buyer beware.
The professor argued, look, maybe that's okay when you're buying a used car.
Yeah.
You check under the hood. But buyer beware, that should never be our slogan for medical care.
Wow. Okay. Let that sink in.
Yeah.
Buyer beware for healthcare.
It just shouldn't be that way.
It really reframes the whole thing, doesn't it?
Yeah.
Moves beyond just your personal checklist and asks bigger questions about accountability from providers, governments, the whole global setup.
Yeah.
Definitely something